So yeah, welcome again, everybody, to Drugs Are Rainbows, a conversation with youthRise, Young Wave, Manus, and Chemical Sisters, hosted by EuroNPUD. We have some great speakers today to chat to you all, and we're going to have a Q&A discussion at the end. This webinar came out of the creation of a small grants project that EuroNPUD was part of from Young Wave. And my name is Lynn Jeffries. I'm the operations manager for the European Network of People Who Use Drugs. EuroNPUD is the regional network fighting for the rights, health and human rights of people who use drugs in Europe and its neighboring countries. So that's me, and that's EuroNPUD, the organization. We're waiting for a few more people to join us, but I will let the speakers take it away if that's okay. I think I've remembered to say everything in terms of housekeeping. If I forgot, just ask me in the chat. Like I said, at the end, we'll have a Q&A and a discussion. So please feel free to put stuff into the chat and I'll feed it back to the speakers. And if you need anything, just message me and I'm doing admin. So without further ado, could I have somebody from Young Wave, Estera or Linus? Do you want to speak a little bit about the project?
Yeah, I'll do a short intro. I suppose so. Yeah, Young Wave, like in general, for those who don't know us, is a Lithuanian-based volunteer NGO that focuses on drug harm reduction services, consultations, and drug checking for the young people demographic. Primarily, we used to be very on-site focused, so we would go to events, nightlife events, and kind of set up shop there. But with time, we've managed to secure some office space, and we can do more walk-in consultations as well.
As well as a lot of our services being expanded, not just to on-site work, but also writing informational content, taking part in European and in broader international projects to develop various areas of our work.
Sure. The project itself was, I would say, maybe in my Young Wave tenure, probably the biggest project we've undertaken, just in terms of both attendees and maybe like the financial scope. As I recall, the project had two parts. In the beginning, there was the train the trainers bit, in which we sort of all settled on, a common curriculum, and it was focused mostly on two parts. One was more towards remote consultations for vulnerable groups and how to handle that platform and sort of the anatomy of a consultation, how to open it, how to close it, what should be kind of the overall approach there. And the second part was, I think, named Access to Justice, where it was focused on a framework for kind of mainly be aware of what the rights are in like certain regions in terms of what kind of healthcare can they get, what kind of services can they get, what is the legal situation surrounding psychoactive justice, etc., etc. So those trainings were in the end held on site in Lithuania. I forget the exact number of how many people we had. Maybe Esther remembers, since she was kind of more present at the site that I was.
Well,
was it 30 something?
Since I believe, since we are talking about a couple of years ago, I feel like the stats are somewhere, but I do not sufficiently.
I think it was at least 30. I remember managing those books, and it was at that point, just having 30 international people come together in the country was a very significant step for us. But when I remember listening to the feedback, what people really appreciated was sort of the hands-on part, is that people got to go with us to an event and sort of see how we operate and how we set up, how we approach people, the drug checking aspect. And from what I remember, that was something that really, really stuck to attendees to have also kind of like that hands-on practical approach rather than just, attending a seminar or attending a lecture.
Yeah, there was
So I'm
also
happy.
there was also quite a lot of general exchange of experiences, because it also kind of showed the differences between like the various organizations, seeing the way that we do things on site, like kind of showed the range of ways that different places like approach, like for example, drug checking. That was one of the things that surprised some people, from what I remember, like the way that we do that, and in spite of all the limitations that we have with, let's say, legal protections and kind of, I don't know, general like conscientiousness at like place where our country is. So there was quite a lot of that, I don't know, sharing of experiences and differences with like all the people that got to see, how things are done here.
Yeah, and then the second part of the project was kind of more oriented towards sort of administration of an array of small grants for other organizations that wanted to have small projects sort of focused in those two areas, either consultations or projects oriented towards the legal framework side of things. And as I recall, that was also very successful. I think we had four or five small projects that were divided amongst different countries: Ireland, Denmark, Portugal, but I don't wanna lie since it was so long ago. So I think that was definitely a first for the organization, that we were actually administering grant money and a lump sum that was way bigger than any budget that we've ever operated on. So it's really nice that the trust was there, and we were able to kind of at least for that time shift our position from just being kind of like a regional service provider to more a focal point for the broader European international harm reduction network. So we really appreciate that opportunity.
Cool. Thanks so much, Linus and Estera. Yeah, it was the trainings that me and Joanna attended. It was my first time in Lithuania, and it was really cool to experience just the different context, I suppose, of what's happening in Lithuania, and experience from a context of younger people, because sometimes in harm reduction circles you don't often get that. So I'll pass over now to Chemical Sisters. Dinah, you want to come in there?
Yes, hello. Can you hear me? Everything works? Yeah, great. Hello to everyone. Nice to be here. Thanks. I'm Dinah from Chemical Sisters, and I'm going to talk about the contributions and the outputs from our caravan pier, as we called it. So we ran focus groups in 3 cities in Italy, in the northern Italy: Turin, Milan, and Bologna. And we held discussions primarily in occupied and self-managed spaces. And this approach, the approach of choosing this kind of spaces, was useful because allowed people to reach us directly, and it recognizes that not everyone has the privilege and the autonomy or the volunteer to call and to participate to such managing focus groups in these self-managed places helped us to reach people that usually don't attend these kind of focus groups. And we also provided some cuts from some journals in order to make a big collage for the end of the journey, for the end of the trip. So while we were chatting and talking, people were gluing and cutting cuts of people of journals. The main theme that emerged from these focus groups were, the first one is stigmatization and judgment. So there is a need for a comprehensive education about substances and sexual practices. So the participants criticizes mainly the gaps in institutional education. Then we discussed how stigma affects not only interaction within society, but also with drug using communities. So the stigma within substances, for example, the difference in using cocaine, so the difference from crack and with snorting cocaine, different settings and different stigma also in spaces where the people think that there is not, for example, rave parties or underground movements that still have big stigma. A very big theme is gender-specific stigma. So as also Chemical Sister is the main theme of Chemical Sister, the theme of intersection of substances and gender was a lot discussed, and the fact that women and non-binary people face judgment and violence related to the substance use. So the double stigma that women can face using drugs. Regarding housing and related issues, we touched this topic mainly in Bologna, and the social exclusion that people can live in a place, especially like Bologna, that it's a main university city with a lot of young people that come in and out. So it's the social exclusion is very high, mainly for heroin users. So there was this sentence that came out that it's like being the ghetto within the ghetto. So people that are discriminating people in the same space. Law enforcement was another central theme that were touched, because in Italy, especially in these years, we are facing a moment of big repression, so a big violence from law enforcement, and very difficult moments for young people, especially that use drugs. So driving license took away, and search on the body in the streets, so people were faced a lot of trauma because of this occasion. And it was highlighted the urgent need for decriminalization better than training law enforcement to handle drug-related issues. Another important theme was peer education, so the gap in peer education, and the emotional awareness was particularly concerning. There was a call for horizontal and inclusive education that can give the same knowledge to everyone, not different knowledge to different characters. Another main theme is chemsex and pleasure. So it was mainly discussed chemsex as a context where pleasure is a central theme, and the use of substances like drugs or alcohol can often link to intensify pleasure or using inhibition. And so there was a very big call for sexual education in Italy. And also the concept of consent was discussed. It took quite a long time to discuss this topic because it's very difficult and it's always very long as a discussion. And the resources that we are going to launch today, and yeah, you can see the pictures that Lynn is sharing. So our logo, and this was the call for the Caravan Pier. So collective reflection on the criminalization of pleasure. And this is the poster, the collage that came out while we were chatting. So maybe later in the question and answer part, maybe other topics will come out.
That's great, Dinah. Thanks for giving that overview of Italy. And I really like the caravan idea that you did, given that like different regions in Italy have so many different issues, you know, depending on where you are. So the caravan, the peer caravan, I think is a really creative use of that. So give me 1 second here. I think next up we have Joanna. Joanna, are you with us there?
Hello. You can
Hello.
listen to me? Yes. Okay. So I'll give you an overview about the focus groups we did in Portugal. Maybe coming back a bit on the thematics that we've elected. When we first entered in this project was, I think one of the main goals was to make evidence that young people using drugs have also something to say on drug policy and criminalization, and also to generate another view on, let's say, drug contents and education. So we had this idea of doing these focus groups to discuss with people, younger people, let's say, but in specific situations, like for instance, experiencing unstable housing. Let's say that we try to avoid the first world youngsters, because most of the answers we see in harm reduction, they are focused on social integrated younger people, namely the access to drug checking, or the services at raves. There is no youth centers or drug consumption rooms directed to the youngsters, so or migrant youngsters or younger women using drugs. So this was one of the points. And actually, I got really lucky because I had the opportunity to develop two focus groups. One of them took place in Gatin Moraria, where there is a huge younger Nepali community. Gatin Moraria is a drug consumption room. And the other focus group was with Manas and some other youngsters from squads in Lisbon, that actually self-manages spaces for safer use as well. So starting from here, we try to address 4 different topics. This would be drug prohibition, drug education, drug criminalization, and messages to the media. And the results were quite fantastic, because we could get some personal stories of life, especially from the refugees and migrants, and the overcross through different continents, and also access to new drugs, and this need of community, of get your community safe, and gaps on safer consumption, for instance, because most of in Lisbon we have 2, so the drug consumption rooms are only open by day. Then there is also this thing of decriminalizing stigma, not only pleasure, because one of the things that younger migrants said to face more was the stigma. First of all, because due to migration, and secondly, due to the drug use or drug selling in some circumstances. And this is something that only when you become like a neighbor, you overcome these stigma barriers. So this was actually quite interesting to see. So here we can address the need of full spectrum harm reduction, that goes from the safer supply to housing, also to peer-led responses, to have these spaces where we can actually not only listen, but to create mechanisms for decision making that includes younger people. And then I think Dina already talked a bit about the gender gaps. Here we have the same, but I wanted to say also that this was a very happy dialogue. So more than 12 people participated. We had some stipends to give to youngsters, and even we split for more people, because a lot of people wanted really to take part in the discussions. Were supposed to take 1 hour, and in the end one of them took the whole morning and the other the whole night. Because it was also a moment, to find your peers and stay there, enjoying. So I have some of the sentences that came about. I didn't bring photos, sorry. My phone was just rolled last week. But so I have this sentence that stayed in my mind, that was actually part of a big cartel that we did in the end. Is like, drugs can be like masturbation, they never break your heart. Or, for instance, like this makes more sense in Portuguese, but like the awareness on consumption opens your mind. It's like consumo consciente abre a mente. I don't know. There were some interesting and crossing, topics and themes. And another thing we found with these focus groups discussions is that actually there is a lot of lack of information, also because everything is English centered or Portuguese centered, So for instance, with the migrants community, we found this lack of translating harm reduction materials to other languages. So giving up of this Eurocentric Anglo-Saxonic way of addressing harm reduction. And this is something that I wanted also to highlight over here. And then also to highlight that sometimes we are so worried with the way we put things forward, but actually if we listen to community, if we grab, like the soundbite sentences, we can actually design like a very nice campaign. And I think these posters are also highlighting that simplicity and addressing at the same time important messages like maximum pleasure and minimum risks, and use and not abuse. And that's all. From my side, that's it. Thank you.
Cool. Thanks, Joanna. Thanks very much. Really good note about language and translation. Just before you joined, I was saying how great it is to have the option of live interpretation at a webinar, but just for one language, like imagine if we could just have it for every language that everyone who is joining speaks. So yeah, definitely something to focus on as we move forward. Rebecca, do you want to come in there and speak a bit about youthRise?
Sure. So I have a few slides. I'm sorry in advance, but I'm just going to share them very quickly. But I'm very happy to be here today. My name is Rebecca. I'm originally from Brazil, but I'm currently based in Vienna, and I'm part of youthRise. I'm the communications and advocacy program lead. I will go into speaking about what we do and about our work in a second. I first wanted to start this conversation because it's really encouraging to see all of the projects that were developed here. Really nice to see the results and also things that are led by young people. And this is a great part of the ethos of youthRise, also of engaging and highlighting and supporting initiatives that are led, that are designed, that are thought to focus on contributing to positive outcomes for young people, by young people. So I wanted to start today. I think I was asked to speak a little bit about the engagement of young people in public policymaking spaces and the challenges that exist in engaging young people, particularly young people who use drugs in those spaces, and talk a little bit more about the work that we do at youthRise, and also ways and recommendations for young people to be able to make a change in the policy arenas in their own context, but also in international drug policy reform. And it is a really pity whenever we talk about the lack of engagement that exists of young people in policymaking spaces, because it is not something that it's coming from young people, it is coming from a structural problem. There is a closure of the spaces, and it becomes essentially impossible for young people to access those spaces for several reasons. And when you think about the policies that we have currently that are regulating drug policies, you think about the reasons for going forward what we know as the war on drugs and the security overly punitive approaches to drugs, and you think about the arguments and the justifications for conducting these approaches. Young people are usually used as an excuse to justify these war on drugs and punitive approaches. Their security, their well-being is constantly something that policymakers refer to whenever they want to justify overly the over-reliance in punitive approaches. But in very rare occasions, young people are effectively included in the discussions about these policies and very rarely their insights are taken into consideration in the designing and implementation and evaluation of these interventions. And this is even more true in the case of young people who use drugs. This is due to the stigma that surrounds drug use, but also the stigma that surrounds young people just because of their age, sometimes because of their identities, because of the communities that they represent, and the overall perception that young people are unable to make decisions for themselves, that they lack any sort of critical skills or any sort of agency in order to decide whatever is best for them. So there is a great level of tokenism that comes from policymakers, which tend to be very privileged, older people in positions of power that perpetuate this exclusion of young people from those spaces. And this is why youthRise advocates for the need of including young people, particularly young people who use drugs or who have been impacted by the war on drugs in all stages of the policy cycle. And that includes the discussion, the design, implementation, and evaluation of those policies. And here I say policy cycle because I think there's this idea that, a policy is an end on itself. But we highlight that policies, they are this circular movement. There's always a need of rethinking those policies, of reassessing, of discussing again, because the needs of people, they change, and the needs of young people particularly, they change depending on the context, depending on their age. And we know that the teenage years and adolescence, it's a very formative moment in a person's life. And people will go through different stages. They will face different barriers. They will face different challenges. And it's important to be constantly engaging young people in those discussions in order to effectively assess their different needs and assess also what are the best solutions for them. And I think this was mentioned already. Some of the barriers that young people face, I think, are mostly connected to the legal systems that we have and the legal frameworks that are now dictating drug policies and drug use status. Although we have seen some developments internationally and some countries adopting more progressive policies, the majority of the countries still criminalize drug use. And that leads us to not only fear about accessing resources and talking about drugs or sharing knowledge, or even trying to access essential and human rights, such as access to health. But that also contributes to stigma and discrimination, even in the places where drugs are decriminalized, because there's still this idea that people are still unable to perceive drugs as something that it's also connected with joy, with pleasure, and as something that it's really important in the formative years of adolescence, and as also a tool for creating communities. Moreover, there are the financial barriers also to engaging. Usually accessing policy spaces, it means that people need to be based in the capital. That necessarily excludes certain youth, particularly youth that are coming from rural areas. And it also demands that people have some sort of financial stability, because a lot of the times it's costly to access those spaces. It's also difficult for people that are trying to work because the positions are unpaid. So there is the need of trying to secure funding, and funding usually also for NGOs, it's an issue. And I think that everyone here working on an NGO will know that it's difficult to secure funding from donors. And whenever you secure it, it's even harder to maintain. There are a lot of requirements also that exist in order to access those institutional spaces, such as the need for proving formal education, which also blocks the people which do not have this formal education in the traditional sense, but that they do have the lived and living experiences with those topics, and hence they have the first-hand insights that can be provided in order to, fine-tune and think about the design of services that will be best suited to serve them. there are also very few institutionalized frameworks and procedures that are designed to think about including young people in the policy development process. And whenever those spaces exist, or there is this idea of bringing and listening to young people in the policymaking process, it's usually marked by tokenism. So they bring young people, policymakers bring young people to discuss policies that have been already decided. And they just bring young people to hear about a presentation about something that was already decided. But then the insights that young people bring do not really alter any of the plans. And they are used instead to just, conceive this sheer layer of credibility to a policy that it's not necessarily agreed by the population that will be affected by the policy. And that all leads us also to this invisibilization of young people and young people who use drugs from these policies. We have no indicators that can measure the needs and also the impacts of those policies on young people. And because of that, it is very hard to monitor, but also to report and to alter the frameworks that are currently guiding national drug policies. And that all contributes to a severe lack of data on the specific needs of young people who use drugs. So this is where youthRise appears and our work appears. We are basically a network of young people who use drugs or who have been impacted by the war on drugs and drug policies. And we advocate for amplifying the voices of young people all around the world, advocating for their needs and bringing them to policy-making spaces and also connecting them with local civil society organizations, but also resources and funding opportunities to conduct their own projects or also to provide their insights in those spaces. We believe in full spectrum harm reduction, which is acknowledging that people use drugs, different drugs in different ways. And it is important to acknowledge all the ways and also acknowledge all of the reasons why people use drugs. And those reasons are not necessarily, in the pathologized sense that traditionally guides policy discussions. It's acknowledging that drugs, as was mentioned here before, are an essential part of, the human socialization and also can contribute positively to the lives of peoples and also to community building. So we have a membership, our management team, we have a membership of international working group members. Dinah is also a part of our international working group and based in Italy. It varies the amount of IWGs that we have, but it's around 30 IWGs, and the IWGs are up to 30 years old. And basically, this is where they are based right now, our membership. And the idea is that IWGs will be representing their local communities, bringing the insights of local communities to us, and helping us in collecting the insights and the data that we can use in international advocacy efforts for policy reform. But also the IWGs will be receiving the support from us in terms of access to small grants, in terms of being able to participate in research, and being able to participate also in the writing of reports and written submissions to high-level advocacy efforts. For example, a lot of what we do is also connected to conducting research and submitting inputs to high-level human rights bodies. And recently, we collected the insights of IWGs and their communities to be submitted to the Special Rapporteur on the Right to Health that was organized by the UN Office on Human Rights. And this is just one example of something that we do. These are two researches that were conducted at youthRise. And they were conducted with young people who use drugs, and they were written by young people who use drugs. So we usually try to emphasize also the specific needs of different populations and different young people that carry specific identities and the intersections that they carry as well. And we conducted two researches. One was focusing on young sex workers who use drugs, And the second one was focusing on young people who use opioids. So we brought them, we organized focus groups, and we came up with policy recommendations based on their insights. And the report of both researchers are available in our website. And it's really important to say that the report was also written by these populations that contributed to the research. So the idea is that we are not conducting research with research subjects, it's rather research co-writers. So they were part of the whole process of conceptualizing the research, designing the methodology, and writing the final report. And then they have always the opportunity of engaging in the advocacy efforts and bringing the results of this research in international forums. Here we have two pictures of two collaborators and co-writers that came to present the results of the research during the CND, the Commission on Narcotic Drugs in Vienna, which happens annually. So every year we try to bring the collaborators from those studies that we conducted to speak themselves about the results, and also to provide them with an opportunity to be there in that room and help deconstructing this idea that only certain people are able to access these spaces. And then this way we provide them the opportunity also of connecting with people from all over the world and networking, and strengthening their capacity for conducting advocacy in their local levels. So finally, I just wanted to bring a few ideas. I think there's a lot that needs to be said about what needs to be changed structurally in order to provide young people with the opportunity to engage in policymaking. There's a lot that needs to be demanded from governments, from donors, from international organizations, but I'm going to limit myself today to just speak about some ideas of how young people, what the young people can do themselves to be more involved in those advocacy efforts in trying to make a change in their local policies. And I think that Young Wave, it's conducted a really, really good project on this, which is about strengthening capacity of young people about their rights and getting them to know about how to access justice and what are the things that what are their essential rights that they have. And this is one of the important things, I think, creating this knowledge and getting to know about the legal frameworks and how they can get involved, but also how they can protect themselves and also their communities and ensure that they are safer. Also getting involved in peer-led initiatives and supporting those peer-led initiatives, providing training on the legal rights, advocacy skills, and harm reduction practices, and attending those trainings as well, so they can acquire more skills and build their capacity to engage. Contribute to building communities, both in person or online, if those communities are not available in their local context, but get connected and then talk with their peers, exchange knowledge, and also find ways that you can contribute to each other and find things that you can do in your local context to get the conversation going and make people aware about the changes that you would like to see happening. Also connecting with local and international civil society organizations and NGOs. This is where youthRise enters, but there are a network of organizations working in the drug policy reform movement. So get in touch with us, and we will connect you with also the organizations that are better suited to help you advancing with your goals. And also finally, just participate as best as you can in local council meetings, public consultations, and international conferences, advocating for your voice to be included in the policies. And there are a number of scholarship opportunities that are available to attending those spaces, because we know that resources are usually a problem. So you can either get scholarships through the network of organizations that I mentioned, for example, youthRise, but then the conferences themselves, sometimes they offer opportunities, particularly for young people, to attend those spaces. So take a look into those opportunities, apply for them, and don't be afraid of occupying those spaces, because it's also a space that belongs to you, and you shouldn't be afraid of being there and exposing and amplifying your voice and amplifying your agenda. And I think that this is all from my side. I included the website of youthRise in case you're interested and would like to get in touch. And you can also drop us an email. Thank you.
Thanks, Rebecca. That's great. Thank you so much for speaking. youthRise is an amazing organization, and a really important place in terms of involving young people in policy making spaces. And I like what you said about, you know, tokenism and people being used as kind of scapegoats in terms of policy, but then not being engaged in the policy and making in the first place. I think it's really important. We've got about 13 minutes left. Before we go into discussion and questions, I just wanted to show people the resources that came out of this project, because I know we've referenced them a few times now, and you haven't actually seen them. So that would be good. Sorry. And I'm also going to email these resources out afterwards. We have them in JPEG and PDF for high quality printing and sharing available. So out of the focus groups that were held, there was 5 resources developed, graphics. Part of the project was how to engage people through social media. So we developed these graphics that can be posted on Instagram and used in other platforms, centered around kind of the 5 themes that came out of the discussion. So this one here, can everyone see this? Everyone see? Yeah. So time to scale up on drug law reform. Obviously, it's a scale. It says decrim. The resources are all really bright and colorful, and I really like them. They were designed by this person, Jiao, who is Empty Pockets, who I think was going to join us today, but couldn't join us. But really cool designs from them. Safer space, safer use. So again, like safe spaces to use for young people. Minimal mixing, maximum pleasure. Again, this came up during when people were talking about pleasure and how pleasure is often left out of the conversation. I think it's such a huge, important topic that often gets overlooked or or disregarded because we can't have pleasure when we're using drugs. You can be high on life and high on drugs. Again, I think this speaks to like young people who use drugs taking up professional spaces and being able to be like professionals who also use drugs. And then drugs are rainbows, use harm reduction as a tool. Obviously, the name of our webinar speaks to kind of the full spectrum harm reduction approach. So those are the resources there. I think, did I go through all of them? Yeah. And I'm going to email those out to all the participants. So yeah, I'm going to stop talking now. Do people have questions? I'll just check the chat here and I can shout them out. One that came up just before Rebecca finished was OAT. Oh yeah, and you've answered it here in the chat. So Christos was wondering, Christos is our OAT project manager and was wondering about OAT services for youth. And then Rebecca said it was a topic that was mentioned in the young people who use opiate study. So that's really interesting because, as we know, a lot of like services, drug services, quote unquote addiction services are only for like 18 and over or 25 and over. So interested to know a little bit more about that.
Yeah, this was something that sorry, the co-writers in the study, they mentioned about the inaccessibility of these services. Usually they have the age of consent, which limits the ability of young people in accessing those spaces. But then there is also a lack of the availability of these services in the majority of the contexts. So there are too few and far apart, and whenever they exist, they are inaccessible for young people, or even if young people can access them, they tend to not take into consideration the specific needs of young people and how to make them feel more comfortable in those spaces. So it's highly clinical looking and make young people not feel really comfortable. It does not really take into consideration also the age gaps, and young people do not feel sometimes safe, or maybe LGBTQI plus young people that are not feeling safe and invited in those spaces. So a lot of barriers, and there is a need to think about how you can best provide this younger population with these very, very important service. Exactly, yeah, as Joanna said, the youth-led centers.
For sure, great. Does anyone else have any other questions or comments?
I would just add that maybe we lack some, or I forgot to mention that one of the main part of our discussion was also safer supply. So, you know, we cannot address harm reduction or youth-led centers without thinking about all the system of prohibition and leading up front the needs of drugs, not only decriminalization, but, you know, legal regulation. So that's something that I would like to state over here. I also dropped here an article I wrote with the peers from Manas and also from Vancouver. And this need of calls for harm reduction youth-leds are here also shaped. So if you want to have a look.
Thanks, Joanna. And I can send those out on the email afterwards with the resources.
And also another thing, the mothers, young mothers who use drugs. It's something that we haven't stated over here, but the risk of the loss of custody and then all the upfront dealing with the trauma, the lack of support from to the mothers is something that I would like to also remain visible over here.
Thanks, Joanna. A question from Daphne in the chat. So how do we define young people who use drugs? Oh, sorry, Daphne, you go ahead.
Yeah, I wanted to explain what I'm asking, the age gap, because we know that OAT is sometimes not allowed to younger people, you know, teenagers, let's say. So I wanted to know, when in this context today, what do we mean by young? Until what age are we considered young?
Yeah, this is a very interesting question, and I think it's a question that a lot of people are making in other spaces as well. The definition of youth tends to be like very loose. And at youthRise, we consider young people also encompassing adolescents. So that goes from, you know, 14, 15 beyond. And then we consider people up until 30 to be young people. Obviously, the needs will vary, and that's what I mentioned, that there are different needs depending also on the context and the stage of their life, on their age. But it is a very interesting question, because I know that the UN considers young people to be from 18 until 24. The European Union considers to be from 18 until 30, and then the African Union considers it to be from 18 until 35. So I think youth, it's better explained also as a moment in life, and it's considered to be the formative years of a person's life, and also the years in which the person is trying to establish themselves financially and trying to obtain some sort of stability. And this is also what puts youth a lot of the times in a more vulnerable position, or the lack of stable housing, the lack of stable sources of income. So I think it's better understood if you understand youth not as an age group, but rather as a period in a person's life.
Thank you.
Also, I would add that, yeah, some people define young people until the 25, some people are not until 30 or 35. And due to the lack of economic stability and, you know, the the systematic, fulfills of capitalism on our skins, I would define it until 35, because we really survive to, unstable situations as youth. So
where I live, drug use, people who use drugs usually define themselves as young, even in their 60s. Most of my friends.
Yeah. There's also this cultural aspect that I think it's very important. But regarding the OAT, it's also, or the access to drug consumption rooms, or any kind of treatment, I think it's very important that we'll never ask the ID, So we believe the person is 18.
What worries me, yes, this is what I ask, because I know that it's prohibitive if you're young to really be into some program to help yourself. And this is why I asked, but at the same time, thank you very, very much.
Thanks. Yeah, there's just oh, sorry, someone want to come in there?
Just kind of on that same topic, I feel like it does kind of like raise a few questions for me, like with regards to like, because from what I understand, there was quite a bit of talk about like including people that are, well, below like the defined ages, so like under 18, let's say, and the access to OAT. Like I feel like I in certain cases, like I can understand like well, I feel like it is quite a delicate like matter of why certain like limitations are placed. Not that not that there shouldn't be some kind of access to help, but with like do you think there's perhaps like I don't know, kind of reasons that would be harder to like move in that sense, like or like I guess what might the trajectory be with like seeking such like changes in inclusion, because like it seems like a bit of a like complicated question.
It's very complicated. If I may say something related to that, let's say OAT. If you are to, it's in order to be in need for pain and for really living your life of OAT, when you're an opioid user, you need to have used for 2 years every day. I mean, no matter what they say when they try to impose prohibition, that's the truth. So if you're 18, shall we? I mean, there are very, very few cases that have been able to use every day and be addicted to the stage that they need OAT. And if you consider that the brain is not really formed, and developed properly until 24, we're not really sure if methadone or buprenorphine or very heavy drugs would be beneficial to a person. So I believe we have to be very careful, because I've been through this horrible pain when I was 19, but I was an exception, I believe. I was one of the very few who were using every day for years. Most of the young really double around cannabis and psychedelics and this and that, and not heavy opioids.
Yeah, like that's kind of what I had in mind, in the sense of I feel like, well, I guess it depends regionally also, but I would say that in the present day there is more information, and I feel like there's a bit less people at ages like 13, 14. I mean, like percentage wise, not that they don't exist, but that there's less people in like that, I guess, very young age category that begin like heavy opioid use. It does happen statistically. I think it's a smaller amount. And that is kind of what I was also thinking, like because I have known cases of people in Lithuania just under 10 years ago that were went to treatment for stimulant use, and due to the lack of information, and treatment centers were given, they were attempted to be given methadone, which like was such a complete like mismatch of like help, and caused worse issues. And I just feel like, it is kind of complicated in that sense, because there's not that many I guess people, and it could also like open up a certain like difficult situation which might like impact other people that, you know, really benefit from the programs that like really, you know, do need that and do like, and it benefits their lives a lot. But yeah, because of like at such a like young age group, like I mean, yeah, it seems like it is very delicate, because like I can understand why certain like limitations would be placed there to prevent some misattribution, which can then send a person further into like a situation that is difficult to like, you know, work through if they choose that maybe they want to not, you know, have that as an ongoing long-term process, but that at some point, if it's given at the wrong time, maybe it could become far more difficult due to those like formative, like the brain being in a formative state, like where, you know, maybe it becomes a lot more stronger, like much stronger link with like opioids. And I also kind of say this from my own experience in a way where it, yeah.
Thanks, Esther. John, do you have a question or a comment?
Yeah, no, I just had a short comment on this, and I mean, I do understand the concern of underage people, you know, and but I think that it's quite simple in a way. If they need medication, if they've come to a point of in their life where they really need something to, you know, to go on, then it would be, I mean, to make people total abstinent in one go is not such a good idea. So it's probably better to then at least make them stable somewhere where they feel okay, they come a little bit to themselves, you know?
Yeah, of course,
because
of course,
I think that's when you can reach them, speak to them, and, you know, get some kind of understanding. At least that's what I think.
No, of course, like that, you know, that no doubt, like of course. I suppose just in the sense of like it's a territory where it has to be like addressed gently in a kind of not kind of maybe going all the like kind of not taking it like too far, because I mean I guess there's also like the questions of not to like doubt people's experiences, not to like invalidate, because again there are absolutely cases of this, it absolutely does happen, people might absolutely need it, like, and it could be extremely beneficial, but kind of, you know, if there is some like maybe lack of information, it like, you know, in the like I feel like there's more room for cases where it could be a like a further issue, as opposed to like, you know, just like obviously there will be cases where it could absolutely be life-saving and like life-changing, but I feel like there's a lot of room where it could raise a lot of doubts, and also with like, I guess, responsibility for like, you know, kind of the longer term outcome with all that. But, you know, it's just like a question of, you know, depending on how the trajectory is going, like it could, if it's addressed in that like delicate way, then it, you know, obviously it could also have like positive effects. But yeah.
If I may add something, sorry for taking your time, Esther, I think I absolutely agree with you and John. I wanted to say that we need to educate the doctors. It's not only the community, the mistakes they make, as you mentioned, especially with young people, when they have to really make happy the parents and not the ill person, the person that needs the help, are very dangerous, and they may ruin lives, as you mentioned about the formative brain and everything. So it's very difficult, and it's our responsibility, I think, to press the doctors as well as the politicians, let's say. Thank you for this. I took your time, but
sure. Thanks, Daphne. Thanks. No, a really interesting conversation. I know we're running a few minutes over time, but just in terms of even OAT for youth and how this conversation came out of that comment, you know, I think part of it is about looking at OAT and what is OAT for folks. It's safe supply. So then reimagining this conversation around safe supply and drug use, not just, you know, OAT traditionally was like a maintenance thing, just for people on maintenance, But obviously we use drugs for all different kinds of reasons, not just for maintenance, not just to not be sick, we also use drugs to be well, to feel pleasure, to do all sorts of things, So it's ties into, I think, safe supply and also bodily autonomy, like someone was mentioning, having the choice as well to say, today I want to be not sick, today I want to be high, today I want to be really productive, and having that choice, and having the choice around substances, and having the choice to not be submitted to a toxic supply, and I think that's what we're seeing in North America now as well.
Yeah.
So
let me just add something. We talk about OAT and opioids, but we forgot the psychostimulants, no? The access to, combinations
exactly.
guides. We shouldn't focus in only one substance. I mean, also another sentences that people brought in was like, all substances are equal. If we don't see them as equal in terms of access, in terms of treatment, in terms of harm reduction, accessibility, and availability, we are already creating some fragments and leading to stigmatization over some users rather than others. So these intersections brings us to also talk about psychostimulants and other categories of drugs that we also need to have availability on treatments, education, knowledge as a power to empower, let's say like this.
Yeah, one tiny thing that I just wanted to like add to that, that like, yeah, yes, of course, but kind of realistically looking at the timeline of, the changes that might like actually appear, in reality, as opposed to like what would be the ideal case, I feel like things will pass through like the phases of like first being in this heavily like medicalized context, and then gradually like moving out because of seeing like the positives of it, and only like eventually it will move out, like hopefully, if if all the steps are followed like in the best way, like it will eventually move towards questions of safer supply. But in the world that currently is still so heavily like stigmatizing, and like often like where things are criminalized, like even from such a low level, like kind of as a realistic like path, it probably will pass through like different phases, some of which obviously aren't quite like the utopian version, and then eventually like to get there, and probably in the way the world is right now, it will have like a needing to be medical phase, and then only eventually becoming like more than that.
Thanks, Sarah. Well, look, we're 9 minutes over time, so I just want to thank everybody for joining us today. I think it was a really cool discussion. I'm really stoked we finally got to launch these resources after not so long ago that we did them. Yeah, thanks everybody. I'll send out emails we'll send out the email to the participants with the resources, the organization contacts, and please, if there's any more questions, keep in touch. And yeah, thanks everybody. Hope to see you all again soon, one way or another. And thanks to all the speakers. Thanks.
Thank you, everyone.
Thank
Very
you.
optimistic for new generation.
Thank you.
Bye.